It's a rarity in cancer, a screening tool that can actually treat, even prevent disease. That's what sets the colonoscopy apart. The sticking point is not everyone who should get one is taking advantage. Here's the latest in this week's Positively Healthy. One could make the case the colonoscopy is a vastly underrated procedure. It's the only screener which can detect and treat cancer in a single sweep.
It's done under light sedation, and we take a small camera and we look up in the colon for little growths in the colon called polyps. Unmanaged, those polyps could lead to cancer down the road, so we remove them before they cause any issues.
Less invasive tests also look for polyps, but unlike the colonoscopy, they are powerless to do anything. Despite its potential, the test often gets a bad rap.
The preparation is probably the most unpleasant part of it. What it does is it clears out your GI tract so that when we go in with the camera, we get a good look.
Even with such a reliable tool, colon cancer remains the third most common cancer in this country and the third most deadly. Doctors recommend people with average risk get scoped at age 50, but there are notable exceptions.
Patients who have a family history of colon cancer or colon polyps should get screened 10 years prior to their first-degree relative's diagnosis, which sounds a little complicated, but usually it's around age 40.
It's essential that you listen to your body.
If you've had a sudden change of your daily habits, you suddenly get diarrhea that isn't going away, constipation that's not going away, or any blood or some weight loss.
Increased awareness is slowly moving the needle. Colon cancers are now being picked up sooner.
Often, if you find colon cancer at an early stage, surgical resection of that cancer is curative.
There's still work to be done. More than 24 million Americans who should have a colonoscopy won't. A gold standard procedure, it has great value when it's used. And it's such a rarity to have a screening tool that can do so much and eliminate the risk.
Absolutely. It's one of the most preventable cancers.